Noticing fever showing up in babies can be one of the scariest symptoms for parents, especially when that fever is high or the baby is only a few weeks old. Today I am going to tell you about what causes infant fevers and what to do when your baby gets a fever, but before I go further, I want to welcome you if you are new to my channel and also to appreciate my returning viewers. You are welcome to my channel once again and thank you for always coming back. If you have not yet subscribed, please do so now. Press the subscribed button. Like and comment so that you will be part of those who will help my channel grow. Okay, let's dive into our today's topic. I will start with the causes of fever in infant. A fever isn't an illness, rather it is considered a symptom of one. A fever usually means that the body is fighting an illness and the immune system is working seriously to bring the body back to normal. If your baby has a fever, in most instances it means they have probably picked up a cold or other viral infection. You should note that it is very easy for babies to get infection, so you should try as much as possible to keep your baby's environment clean at all times, and again, personal hygiene should be your watchword. Other causes of fever in babies includes the baby catching a cold, so I will advise you not to expose your baby to too much cold, or maybe she has just been vaccinated and her body is reacting to the vaccination. Maybe your baby is teething, which can lead to a pretty high temperature on your baby, or the little baby becomes overheated from being dressed too warmly or spending too much time outside on a hot day or living in a room with no ventilation. Dehydration is also one of the common reasons your baby is catching a fever. Some babies may not take in enough fluids, which causes a rise in body temperature. This may happen around the second or third day after birth. If fluids are not replaced with increased feedings, excessive loss of body water can develop and cause serious complications. Intravenous fluids may be needed to treat dehydration at this state. So this is what you should do once you start noticing that your baby is having a fever. If your baby is under age 1 month and has a fever, I will advise you to contact your child's doctor right away. But for older babies, I will say, try these tips to avoid an escalated fever. Number 1. Start by bathing your child with lukewarm water, and please don't overdo it. Always check the temperature of the water on your wrist before washing your baby so as not to boil your baby. Number 2. Dress your baby in a light layer of clothes. Dressing your baby with light cloth will give her fresh air and normalize the temperature of your baby to the room temperature. Number 3. Give your baby enough fluids to avoid dehydration. Those fluids should be breast milk, formula, an electrolyte solution, or water, depending on the baby's age. Ask your baby's doctor for guidelines. A dehydrated baby may have fewer wet diapers, no tears with crying, or a dry mouth. Number 4. If your child is older than 6 months and your doctor says it is okay, you can give your baby either children's acetaminophen or children's ibuprofen. Never give babies aspirin because of the risk for a rare but dangerous condition called Reye's syndrome. Also, do not give a baby under age 6 months any medicines that contain ibuprofen. Be sure to ask your doctor about the dosage and read the package instructions before giving your baby a fever-reducing medicine. Follow these instructions if you want to take your baby's temperature. You can take a child's temperature in a few different ways. For babies and toddlers up to 3 years old, taking the temperature rectally, by placing a thermometer in the baby's anus, is best. This method is accurate and will give a quick reading of your baby's internal temperature. The second way of taking a toddler's temperature is underarm temperature measurements, which may be used for babies ages 3 months and older. Other types of thermometers, such as ear thermometers, may not be accurate for newborns and require careful positioning to get a precise reading. Skin strips that are pressed on the skin to measure temperature are not recommended for babies. Touching your baby's skin can let you know if he or she is warm or cool, but you cannot measure body temperature simply by touch. And the third recommendation is orally, which is through the mouth, but we should note that oral and rectal thermometers have different shapes and one should not be substituted for the other. Do not use oral thermometers rectally, as these can cause injury. Rectal thermometers have a security bulb designed specifically for safely taking rectal temperature. Rectal thermometers provide the most accurate temperature readings and can be easiest to take in an infant. To take a rectal temperature, first make sure the thermometer is clean. Wash it with soap and water or wipe it with rubbing alcohol. Lay your baby on her belly or on her back with legs bent toward the chest. Apply a little bit of petroleum jelly around the thermometer bulb and gently insert it into the rectal opening. Hold the digital thermometer in place for about 2 minutes until you hear the beep. Then gently remove the thermometer and read the temperature. Make sure you consult a pediatrician if the fever symptoms in your baby persist beyond 2 days after following the above guidelines. Your doctor will run some tests to be sure your baby is not actually suffering from some kind of infection or other complicated issues. Thank you for watching my video to the end. I look forward to seeing you in my next video. If you have not yet subscribed, please do so now. Subscribe, comment and like, and I will see you next time. Bye.